Hi, Shelley DeSimone here from Human Resources, and I want to talk a little bit about the self-attestation form that the hospital is rolling out to all employees and physicians on Friday, April 3rd. The form is online and can be accessed in a couple of different ways. It's a great tool for us to use to collect information about employee attested symptoms, and it will allow us to ensure our patient safety and our employee safety as it relates to COVID-19. The reason why we're doing this is because we want to find a way to collect information in electronic format that we can get to occupational health as soon as possible so that they can evaluate the symptoms and concerns that have been brought forward on the form. As I said before, the form can be accessed in a variety of ways. It's kind of cool, it's high tech, it's easy to use, and you'll find that it's easy to adapt to, and hopefully it will become second nature to all of us over time. I do want to caution everyone that the rollout is going to be over time, so we expect us all to get used to it, and it will become part of your routine, just like bringing your badge every day to the screener has become routine for us, and being screened has become routine for us. One thing I do want to say about screening is that this attestation form is not in place of our in-person screening process that we put in place just a couple of weeks ago. We'll still have our screeners at our variety of locations asking symptom-related questions of our employees. So we'll have a double check, at least for the time being, until we all get used to this online form. Now I want to talk to you a couple of minutes about how to access the form. So I'm going to do a little demo for you. I have a faithful assistant here, Katie, and Katie is going to learn about how to use the form. So it's cool. What you're going to do, Katie, is use your cell phone to scan a QR, is that what we call it? A QR image. The QR image looks like this. We see it at the grocery store and on packages. What you're going to do with your cell phone is scan it, and it will launch an online form. So Katie's going to demo. So what Katie is doing is using the camera feature on her phone and just focusing on the QR. When she focuses on it, it automatically downloads a software that allows us to view the form. I will tell you that the QR form is available to use on all smartphones, as far as we know. We're told that it's used on Androids as well as iPhones. For those that don't have smartphones, there is not this capability, and so there's a plan B for folks in that circumstance. The plan B is online. So we have a link currently live on and online that you can launch. You can also take this URL that is directly linked to the form and have it as a placeholder on your home screen on your computer. We'd like you to do it at home before you get here so that you can attest to your symptoms before you come on to work. We also have this available on the website. So what you'll do is launch the form and complete it. You'll see, and I wish that this was, can you do it? Yeah. Yeah, it'll say BILH Staff Health Form. You'll have to indicate on the form who you work for, Anna Jaques, and a variety of other information that will be really self-explanatory when you see it. Please contact Human Resources if you have any trouble accessing this form. Our other recommendation is for you to work directly with your manager who is familiar with the form and can help guide you towards resources that will help you complete it in a timely way. Thanks so much for your understanding and flexibility as we start a new process, and let us know if you have problems.